You may have heard its name whispered in the media, in news reports, or seen it featured in medical dramas on television. Propofol. It sounds complex, and in many ways, it is. But at its core, Propofol is a powerful and widely used intravenous anesthetic agent. Think of it as a medication that helps induce and maintain a state of sleep, or general anesthesia for medical procedures. Its primary job is to make patients unconscious and unaware, ensuring they feel no pain or discomfort during surgery. It has become one of the most common tools in an anesthesiologist's toolkit, essential for millions of operations performed safely around the world every single year. Why is this particular drug so talked about? Part of it is its effectiveness. Propofol acts incredibly fast, often putting a patient to sleep in under a minute. The journey of Propofol from a laboratory compound to a global anesthetic standard is a fascinating chapter in medical history. Developed in the United Kingdom by Imperial Chemical Industries in 1977, the initial formulation used a solvent, Cremophor-EL, that triggered severe anaphylactoid reactions. Scientists returned to the drawing board. In 1986, an improved lipid emulsion arrived, first in Europe, then FDA approval in the United States in 1989. It eliminated the severe allergic reactions and paved the way for widespread adoption. Anesthesiologists embraced smooth induction and rapid clear-headed recovery, valuable for outpatient surgery. Popularity soared. It replaced older drugs like sodium thiopental. But there is a dark chapter. In 2009, the tragic death of Michael Jackson brought Propofol into the global spotlight. His death was ruled a homicide from a Propofol overdose given at home as a sleep aid. Propofol is not a sleeping pill. It is a potent general anesthetic requiring continuous monitoring in a controlled setting. It can depress breathing, even stop it, and dangerously lower blood pressure. The lesson: restrict use to qualified professionals trained to manage complications, a tool for healing, dangerous in the wrong hands. To understand why Propofol is so effective, we need to look at how it interacts with our brain. Some neurotransmitters excite the brain, others inhibit it. Propofol enhances GABA, the brain's primary off switch that reduces neuronal excitability. By binding to GABA-A receptors, it helps the GABA key turn the lock and holds the channel open longer. More chloride flows into neurons, making them less likely to fire. Research, including MIT work, shows Propofol synchronizes brain waves, especially slow delta oscillations. These slow waves disrupt the communication needed for consciousness. It changes the brain's rhythm, not just its volume. This is why Propofol induces sleep and amnesia, blocking the formation and consolidation of new memories. In surgery, it keeps patients unconscious, immobile, and free from psychological trauma, a finely tuned chemical key to control consciousness. Data visualizations reveal region-to-region changes in connectivity consistent with loss and return of responsiveness. From eyes wide open to closed, Propofol systematically guides the brain into a reversible, controlled unconsciousness. The body's handling, pharmacokinetics, explains the rapid onset and offset. After IV injection, high-flow organs, especially the brain, see it first. Highly lipid-soluble, it crosses the blood-brain barrier within seconds. Patients can go from awake to anesthetized in under a minute. Then it redistributes to fat and muscle, dropping brain levels and enabling rapid awakening. Short clinical duration reflects distribution half-life, not complete elimination. The liver metabolizes Propofol into inactive, water-soluble compounds. Byproducts are filtered by the kidneys and excreted in urine. Clearance is high, preventing buildup and aiding clear-headed recovery. Sometimes clearance appears to exceed liver blood flow, suggesting extrahepatic metabolism. This enables continuous infusions for long surgeries with predictable wake-ups when stopped. The body's swift, efficient handling of Propofol is central to its safety, precision, and popularity. Propofol is powerful because of its precise, controlled dosing. Only trained professionals should administer it, using careful calculations for each patient. Safety depends on constant monitoring and readiness for emergencies. With respect and vigilance, Propofol is safe and effective. Please subscribe for more.